Hypodermic needles are thin, hollow needles used for various purposes, including administering medications, vaccines, or other substances into the body, as well as for drawing blood samples. They are designed to penetrate the skin and underlying tissues to deliver or extract fluids. Hypodermic needles are designed to penetrate the skin and consist of a thin, hollow tube called the shaft, with a sharp tip with a cutting angle called the bevel. The inside of the needle, the hollow bore of the shaft, is called the lumen. The tip is the sharp, pointed end of the needle that is inserted into the skin or a blood vessel. It's typically made of stainless steel or other materials that can maintain their sharpness. The hub is the wider, non-sharp end of the needle. It connects to a syringe or other medical device for the injection or extraction of fluids. The hub is often color-coded according to needle gauge for easy identification. The shaft of a hypodermic needle is the long, slender, cylindrical portion of the needle. It extends from the needle's hub, the wider, non-sharp end, to the needle tip, the sharp, pointed end. The shaft is the part that penetrates the skin or tissue when the needle is used for injections or other medical procedures. It is typically made of stainless steel or another material designed to be strong and rigid while maintaining a sharp edge. The bevel is a specific feature of the needle tip. It refers to the slanted or angled surface at the very tip of the needle. The bevel design can vary, and it affects how the needle enters the skin or a blood vessel. The bevel's orientation can influence factors such as ease of penetration and the risk of tissue damage. There are different types of bevels, including regular, short, and long bevels, each with its own characteristics and applications. The lumen of a hypodermic needle refers to the hollow interior of the needle, which allows for the passage of fluids. It is the space within the needle shaft where medications, vaccines, or blood can flow. The size of the lumen is an important consideration when choosing a needle, as it affects the rate at which fluids can be administered or withdrawn. Needles with larger lumens can handle thicker fluids or larger volumes. Hypodermic needles come in various gauges. The gauge refers to the size of the lumen, with 27 gauge needles having the finest lumen and 13 gauge needles having the largest lumen. In the veterinary clinic, the most commonly used needle gauges are between 18 gauge and 27 gauge. The choice of gauge depends on the specific procedure, location of injection or venipuncture, and the viscosity of the substance being administered or extracted. The scientific term for the thickness or resistance to flow of a liquid is viscosity. Viscosity is a measure of a fluid's internal friction, and it determines how easily a liquid flows. Liquids with low viscosity flow more easily, like water, while liquids with high viscosity flow more slowly and are thicker, like honey or molasses. Needle lengths can range from 3/8 of an inch to 3.5 inches in length. The appropriate length is chosen based on the intended use and patient's anatomy.